First up was this girl, and we did not have to look far to find the problem. After a little bit of trimming, we discovered that she had what we call a sole fracture, and that's when that sole actually pulls away from that heel bulb. We used a lot of chlorhexidine and trimmed away a lot of that loose horn that was around that area. We cleaned it up really well and wrapped her with salicylic acid. A couple weeks later, we came back, and this is what it looked like. Not pretty, I would say. However, after we got it all cleaned up, it looked way, way better. So once again, we gave her a salicylic acid wrap, and now we're back, about a month later, to see how it is. First thing we can tell, this block has got to go. It's starting to wear. Regardless of what that other claw looks like, we're going to take this block off and replace it if need be. And that baby is really on there. Now you might think it would just be a lot easier to grind that thing off, but the way that that rubber is, it really doesn't grind that well. So the best thing to do is just keep prying away and pop that glue free, and eventually it comes off. So what I'm looking to do here on this recheck is just make sure we don't have any digital dermatitis that's still there. That's going to keep this from healing. There is a little bit in between those two claws. You might be able to see there. And then I'm just going to trim this up, make sure I've got the correct sole thicknesses across both claws. As we move in a little closer, we can see that that sole is looking much better now. We've got some decent depth there after the last couple months, which is good considering the way that it looked. This heel bulb still got a little bit of work there left to do before that's all healed up nice. This area here, this little yellowish, pinkish area, that's just some residue that was in that hoof horn when it was created due to that problem that we had. There's a nice white horn underneath that, so that's a good sign. These brown spots, nothing to be concerned with. I'm not going to go digging for those. Once again, that's just on the surface. We're going to get this sprayed down really well and get her wrapped once again to take care of any of that digital dermatitis that's still remaining there. On yesterday's video, we did a follow-up on a couple of cows, and today we're going to follow up on a couple more. Welcome back to Nate the Hoof Guy. Right up here is that lesion in question. Now with this one, we used a new block. We were testing it out, a little bit thicker, a little bit larger size. Wanted to see if that extra elevation would help the healing process. See that lesion there? We wrapped it with salicylic acid, and now we're back, in this case, 1 month later, to see how it is. Take a look at that, and you see there's still a little bit of dermatitis there, which I was surprised by. I figured if that block did stay on, and it did its job, that dermatitis would heal up. But as you can see, there's still a little bit there. We're going to get this all trimmed up, and then we'll investigate it a little closer. Well, it's certainly much improved, but there is still a little bit there. So how did the block perform? Well, if we take a look at the side profile, it held its shape really well, didn't wear too much, which is exactly what I want. I want a nice soft block that doesn't wear, so it maintains its shape, keeps that foot in the right position. So I'm going to say it passed the test. We're going to give this foot a wrap up. This should do it with this one. That dermatitis should be gone, and on the next visit, we'll pop the block off on her. Next up, this girl we saw earlier this spring, and this video was titled "The Worst Hoof I've Seen in a Long Time." And for obvious reasons, this one was a doozy. In fact, I can't even show you it all right here because of how severe it actually was at the time. But we got it all treated, wrapped it up. Actually, in that first video, we did see the follow-up as well. Here you can see her leaving the chute. She was not walking very well even after that. 3 weeks later, you can see what it looks like. Not great right now, but believe me, this was a drastic improvement. We gave her a wrap, and once again, we brought her back. You can see how much better she's walking right there. Now we're back 3 weeks later once again, and this area is really starting to close in nicely. Once again, we cleaned it up and wrapped it and let her go. Now we're back about 2 months later, 2.5 months later from that time, and she is doing much better. That block is off. We're gonna get this all trimmed up and get a good look at it. Now with this one, I don't want to get too carried away with the trim here. All I'm doing is checking this medial claw to make sure there's no signs of stress in that one from having that block on the whole time. You can see this is healed up quite well. It's impressive. However, a lot of times there's pedal bone malformations because of these, so she may not be out of the woods yet. But that's going to do it, guys. As always, thanks for watching, and we will see you all on the next one.
Well, that's certainly an interesting find, but the question is, what caused it? Welcome back to Nate the Hoof Guy. Based on the shape of that gouge, she clearly stepped on something. Now the question is, how deep did it go, and did it go all the way through? Before we go any further there, a quick trim up. My job now is to follow this mark all the way down. Hopefully, it doesn't make it to the corium. We've reached the bottom of that mark, and there is the smallest little bit of corium exposed, so that means we need to put a wrap on. And today, we're going with a brand new color thanks to 9-year-old Ziva, who sent me these in the mail. New wrap color unlocked, and she is done.